We're talking about.
He's asking what points do we use with the psychiatric patients. I'm going to discuss two systems with you. One is to do the same ear points that we're using for the drug abuse patients, and the two is to use more like the TCM 5-element model. So I'm going to do that part second. We're going to stick with the ear points first. It'll be much easier to see how the ear points work once we get some responses, we get some interaction. Now, are there any other questions or comments before we proceed? No.
The second point is, do you use body acupuncture and core acupuncture together, or do you use it?
He's asking, do I use ear and body acupuncture together or at different times? As a doctor, part of my responsibility is not just to treat individual people, but to set up a treatment system for a lot of people. So you set up a treatment system very often. You want to set up something that is very teachable and very reproducible. And so we use the ear acupuncture in ways that are convenient and then ways that are necessary in terms of treatment. For instance, I run a clinic for AIDS patients. Every week I see about 15. I have an assistant who does ear points on every one of the people before I start with the body points, because I want to settle people down and reduce fear and improve their focus, and then the rest of the treatment will go better. We used to think that we were using ear points just for convenience, and that if we only knew the right body points, it would work a lot better. It took me several years to understand that just is not the case. If I had to use body points for addiction, I would do less well than if I had to use ear points. I started out thinking just the opposite. I wrote several articles saying that it was just the opposite. You learn this big subject, and then you say, oh, well, most of it isn't important, we're just going to do this. Those are things that are not altogether obvious. But I remember sitting in the clinic, and we have a couple hundred patients a day for 20 years, so you get a lot of information. Addicts are very convenient patients because they honestly refuse to come back. They honestly say, you don't know what you're doing, and you can tell when there's something that's happening. And I began watching to see which of the patients, we had staff who were very good at body point treatment, and we do, we need to do extra, we need to do more. And number one, you didn't see the improvement. You saw the staff desire for improvement. You didn't see the improvement. We take urines every day, you look at attendance, you can see who's doing well. Second bit of evidence, we used to have a protocol where we had byway and we had Acu, and we did that on everybody in addition to the ear points. And when you have a protocol, it's hard to know what is necessary and what just makes you feel good. And so one time I said, we're just going to not do these points on the hands. Make up a reason, just we're not going to do it for a month and see what happens. Well, first of all, none of the patients asked for it, which tells you a lot. And there didn't seem to be any change. We did the same thing with byway. These are very useful acupuncture points, but it doesn't mean I have to give you 2 kind of noodles if I already gave you 1 kind of noodles. Right? It could be enough. We eliminated this point. Nobody asked for it. We used to have general medicine and drug abuse treatment all in the same room. So you'd have about 50 people a day with arthritis and all these things, 50 people a day just with drug abuse. And one of the drug abuse patients are historically considered to be very needy, very self-centered, very demanding. And I would do ear points in about a minute, And then I'd spend 20 minutes with this other person, listening to all their worries and the way you do when you're taking all these questions. Our drug abuse patients almost never ask for body points. And the body points hurt less often than the ear points, so that was quite clear to them. And the only time they did ask is when you had people who were high. And so they were out of it. And then they were asking for attention. But the people who wanted to get better, and if you walk 4 miles to the clinic and your life depends on it, you get into it, you want to get better. You don't want to have bad treatments, lousy treatments, second-rate treatments. Had people who were very concerned about second-rate treatments. You just didn't get that feedback. And so, based on all these things, it becomes increasingly clear that these ear points have a value that is quite different than other treatments. It doesn't mean that I couldn't do almost the same with other points and so on like that. I don't see any indication I could do better. That throws you into an angry thing of why? Why is that true? And if that's true, how come I have to learn all these other things? What is going on? This is an irritating discovery. Let me help you through some of that. We have in the Bronx people coming from all sorts of parts of the world, and we have a lot of immigrants coming from Puerto Rico. Come from the farms, and you'll see a woman who's worked on the farm all her life, her toes don't go straight like that, toes spread out, because she's walked barefoot all her life. Very grounded, full of yin and earth energy. Well, in our program, we used to give everybody ear points just so people would have a chance to practice while they were waiting to get the arthritis treatments and so on. And most of the Americans, about a third of the Americans who were not addicts, would fall asleep and show very obvious reactions to the ear points. Very often, so much so that you didn't even worry about their other problems until they got more stable. But these women from Puerto Rico, we treated a couple hundred of them, they never reacted to the ear points at all. They would often say, well, when does the treatment start? The Americans would never say that, because even though they may not be falling out, they knew that they could feel something was happening. And it taught me, I think, that what we're doing with these treatments is we are grounding the person. We're developing not just the yin energy, but the whole energy that makes the body sort of steady in one place. These women didn't need that. They lived all their life walking on the earth, and grounding is what they're good at. People in China and Asia over the centuries didn't need that. So if you don't need that, you're not going to discover treatment for something that is not your problem. We look at all these machines that go back and forth, and we drink plastic all the time and so on like that. After a while, you do need these things. And you especially need these things if you've been frightened or traumatized or chemically deranged, so that you're not in your own process anymore. The ear is something that doesn't change very much from birth. It doesn't do a lot. It doesn't. The external ear doesn't have a lot of jobs to do. So this is a way of interacting with the baby in all of us, so to speak. This interacts with issues that are issues for a baby as well. And so I think these ear points are helping the person develop and grow and center again. And so if you had a person come in, for instance, who had lupus, and the person was very frightened and very disturbed and very panicked and very embarrassed, you might try the ear points for a week or two to settle that person down, to prepare them for your general acupuncture treatment. Many people are too frightened to, many people are too frightened to lay down on the bed. They're confused, they're not sure whether you're important or they're important. Basic things. And the ear acupuncture is just a preparation for basic things. A lot of times that's all a person needs. I would be the first to tell you that treating something like lupus, they need a lot more than that. And they need what you've gone to school to learn. But just because I know how to do a technique doesn't mean the person is in the right position to receive that technique. You have to prepare for these things. And this is a simple treatment. If you read the old Chinese medicine, you would get the impression that people took pulses early in the morning. They often did exercises and balancing exercises. You don't want to read the pulse. The person's afraid of you and nervous and doesn't know what's going to be something about them. And very often when we talk to people in the private office, the main thing we get is that they're afraid and nervous about being there with you. Nervous with themselves in all sorts of situations. That's in this kind of approach. Now, what I'd like to do fairly early is to get some examples, not so much so you can see me do the treatment, because you're not going to see very much. You'll see the back, and if you're interested in seeing the back of me, that's fine. These are very small needles, and that's it. You know? But I want to observe and help us all listen to what the results are that the people might have. And that's what I'm interested in doing. And we have 1, 2, 3, 4, 5. And so what we need are 5 people. We have a lot of volunteers, next to no volunteers. If we have some volunteers, then they should. I try to tell the Americans that the Germans are more relaxed about these precautions than they are, and they have trouble imagining that, but that's true. Because that's not to say people here aren't careful and compulsive and all that, but that is to say that the Americans' reaction to these things have to do with fear and panic and projection, not logic. And that's my job, to treat fear and panic and projection. That's what we did, right? Now, this is very impressive that you all stay seated. That's good. Well, that's a very good thing. Wonderful. Now, what I'm going to do is just do 3. Sorry. Oh, no, I did it. Now, put your feet on the... Okay. So we had somebody else go with me say hello to him. Because that was when they had only doctors doing the treatment. I talk about how one feels with the needles in. Because you're just posing or you're dizzy. She's dizzy. You've got a little bit of bleeding here. We need a tissue. People come in who are very upset and distracted, and you see what a difference this can do. Because if you don't have these kinds of information, it seems it doesn't necessarily make sense what we're doing. And this is a treatment that is valuable because it's practical, like much of medicine. Let me talk a little bit about the advantage. As soon as we finish, then we'll talk about 5 moments and such. Let me talk about how this treatment helps the treatment system in general, the counseling system in general. First of all, I have to say that drug treatment in Europe in general and in Germany is not very good, not very extensive, and not very successful. That doesn't mean there aren't individual programs that are good and successful. But I've seen programs, I've seen about 25 in Germany. And, it's comparable to a lot of other places in Europe. And it's not successful primarily because the expectation of how well people can do is very low. And it's lower in Holland than it is here, but it's pretty low. And that people expect that this person who's a junkie and an addict really isn't going to change very much and not going to do very much. So we have to provide minimum treatment, minimum methadone without really a lot of other services, and just be cautious and so on. And as I asked the people in Stuttgart yesterday, I said, why is it in Harlem and the South Bronx, we can assume that most of our patients are going to have a long period of sobriety, and programs in Germany don't assume that at all. My patients have more trouble, more desperation, less income, remarkably less choices and chances in life, and yet we assume that, 50% of my patients are homeless. 40% of the women are incest survivors. Those are serious problems. There are a lot of other problems in addition. And yet, in the program, we make assumptions that people can respond in a way that is not done, not only here, but not done in other locations. And that doesn't say some people aren't different, that says it in general. And I think a lot of that has to do with the image of what treatment is all about. And when you learn about acupuncture, hopefully we can sort of adjust that image. Ordinarily, when I got in the field as a medical doctor, what was treatment about? Treatment was about treating the withdrawal symptoms and the crisis of detox. And if I did that well, then you sort of made a referral somewhere and you did what you were supposed to do. In the beginning, we made treating withdrawal symptoms very complicated. We used short-acting barbiturates with alcoholics, which is ridiculous. But after a while, we learned you can use benzodiazepines for alcohol and you can use methadone for narcotics, and you can treat withdrawal symptoms very easily. Acupuncture will also do that treatment about as easily, but all these treatments are convenient. And the person will say, well, this person has a behavioral disorder that's gone on for 10 years. We treat withdrawal symptoms in a week and a half. It's okay. Well, that doesn't make any sense the more you think about it, and it doesn't work out very well. So what happens is if I'm a doctor and I treat withdrawal symptoms, I'm doing the best I can. I'm doing the protocol I know. I'm using medications that I know about. And yet the patients start out good and then they keep turning bad again all the time. So I get discouraged. I said, what is it can help? Now some programs, if you have a lot of money, you get programs that provide all sorts of social support. There's a program in Amsterdam I remember visiting. They find you an apartment, they get you lunch, they help with this, they help with that, they help with something else. Well, as soon as I heard all this, I knew that they weren't having any success either. Because when you, the definition of addiction, one of the best definitions of addiction is you cannot give the addict anything in a useful way. I give them something. Oh, I'll sell it for more drugs. I give them something else. Oh, I'll hustle it for more drugs. I give them something else. Oh, we can trade that in for something else. Oh, I need this letter that says I have cancer, then I can get more methadone because I got cancer. Oh, I'd like to have this, I'd like to have that. And somebody says, this person sells drugs that are dangerous, all their customers start to die. Well, what happens is that dealer gets more customers. People come and buy drugs because they want to buy something that is harmful. That is the whole point. They're trying to harm themselves. The cloud is the pretense is, so I'm just doing it to feel good. I want to feel better. That just isn't the case. And it isn't the case almost any time. So a person, and it will turn everything you do, every nice thing you do gets turned into something harmful. So what can I do? I treat this person nicely. I listen to them. I talk with them. And then they go out and seek a boyfriend or a girlfriend who treats them really terribly. And I said, you shouldn't, you deserve more than that. They go out and seek someone else who treats them badly. To give you a New York example, you have a person standing in the window ready to jump. And you say, you're a good person, don't jump. They jump. You say, you're a bad person. They turn around because we have something to talk about. This is not only true for addicts, it's true for depressive people, it's true for paranoid people. They cannot tolerate anybody who gives them good news, and they don't respect anybody who gives them good news. Suicide rate goes up in springtime, and it goes up when the sun rises. That is good news, is what affects people, because the good news is so different than their own world. And if the springtime bothers you, what kind of doctor can I be? Right? I'm trying to give something that gives you more life and more relaxation, and yet springtime frightens you. Everything frightens you. And so it's a situation where people say, well, what can I do? There's nothing I can do on the outside. And that's correct. That is totally correct. There is nothing you can do. Threats won't work, promises won't work, all this stuff won't work. And then you say, well, what is this? What is going on? And they have a saying in Alcoholics Anonymous, and the term is an inside job. And what it says is that the primary way that this person's going to get better is through their own process of growth and change internally. Through their spirit, through their self, through their whatever. And at first you say, well, that's an all right theory, but this person is terribly destructive, this person doesn't do anything right, this person has no promise of anything like that. How can they possibly have this inside job? Only good people should be able to grow like this. And that's where the mistake comes in. Number one, we can all grow like this, but growing like this is difficult. And so you grow like this when you're desperate. And you talk about spiritual change. Well, spiritual change isn't when I pay $100 to go to the ashram because it would be good to have a spiritual change. Spiritual change is when you're walking on the desert and you don't know what's going on and you're lost. And then something comes on. Spiritual change comes best to people who are desperate, people who hit bottom. And we are using acupuncture in a context to support this process. And how does acupuncture even relate to this process? Remember I said before that you couldn't give anything to an addict. Most of the time you can't even touch them. They're not interested in being touched. They're frightened. And when people are frightened of having their blood drawn, they're frightened of you doing things to them. And so acupuncture, first of all, gives you a way of touching people. That is okay. Oh, I'm not sure, I don't like that. Well, then you touch the right spot, and you touch it in a way so the person responds. And if you're in the field, this is a very striking thing, that now you have a chance to touch the person and be in a natural nurturing process rather than not have that. Second thing that acupuncture does is remember I said you couldn't give anything to the person because they wouldn't want it. And they would be bothered by it. This allows you to give a person quietness, give them privacy, give them solitude, and they'll take it. When you visit a drug treatment clinic, I remember this drop-in needle exchange place in Frankfurt. They had what they was called junkie art, all the pictures on the wall. And these pictures were very jagged and wild and strange and so on. And they said, well, this was done by all the junkies, all the addicts. And I said, no, it wasn't. What do you mean? I said, that was done by people before they got their drugs. That's people who need drugs. If you want a picture that was done by someone on drugs, they don't draw all these jagged lines. They just sort of smoosh up a little yellow and white and lay back. They don't do it. Drug addicts do not want to be noisy and nasty and wild and all that. They are buying money. They are paying money to shut up, to be quiet, to be polite, to be silent, to be zorked out. That's what they're paying for. Peace at any price. And so I'm going to give you peace at a good price. Peace at a constructive price. And I'm going to give it to you in a way that you can tolerate. If I sit there and I say, oh, we're going to do this treatment and it's going to help your body improve and all that kind of stuff, the person doesn't like that. All of them, we're just going to put these pins in. Now the person's going to observe that their body is improving. They're going to observe that there's calmness and there's settled behavior. So acupuncture is not only doing a treatment, it's teaching the person what is possible in their own system. That is very important for a drug addict who feels that nothing good is possible. And their whole system is broken. And it's very good for all the rest of society who certainly agrees that nothing is possible and their whole system is broken. Because everybody needs to see that in 15 minutes I can take somebody who yesterday put a screwdriver in their eye and missed. Today they're going to be calm and be able to work in this program. And I expect that happens. I don't have any times when that doesn't happen. That doesn't mean their whole life is better. That means I can show them the possibility that they can be calm and easy, and the possibility that something like an inside job, that is their own development, might actually occur instead of just being a cruel joke. To treat drug abuse, the first thing you have to do is make the person feel safe. The second thing you have to do is indicate that the whole thing still works, that improvement is possible. That's very different than most healthcare. Third thing you have to do is give the person possession of something, because what you're doing is taking away something from them. Most time when I do healthcare, the first thing that happens is I give you something. With addiction, what's the first thing? You're going to lose a love object. You're going to lose this heroin that's been your life. You rented your kids out to have a little more heroin and so on. And suddenly, right in the beginning, oh yeah, you can't have that anymore. We're not going to do that anymore. Well, that's very shocking. And so the first thing that happens in healthcare with addiction is you take something away that's valuable. When did I want to do that? If I have something that I like that's valuable, and all of a sudden you're going to say, you can't have it. What day do I want to volunteer not to have this? This has the same thing to do with spouse abuse. The person is there, and they're connected because this marriage has a value to them. It may also be harmful, but it has a value. That's why they're there. And they're too weak and too frightened to go for anything else. I'm in the ocean, and somebody threw over a little string. I hold on to the string. Right? It may not hold me up, but what? I should hold on to nothing? I'm going to hold on to the string. And somebody else throws up a little bigger rope over there. You got to let go of this one to go over and get that one. Well, I'm not sure I can get you. How many of us want to throw away something that we're holding on to out of desperation? Not very many. So the drug abuse treatment, right from the first day, has to be safe. It has to provide some relief so the person sees that improvement's possible. And it also has to be replace the loss that took place. Replace the loss right away. Not a week later, a month later. Well, psychotherapy and group therapy has none of these three characteristics at all. It may be very valuable in the future. It may help you change your behavior. That's what I learned at school. It has none of these characteristics. I see this stranger, oh good, you can trust them and admit all your weaknesses and they'll help you. Well, I'm an addict because I don't trust other people. I don't even trust myself. Now I'm supposed to do all these other things. I'm just going to be more of a victim. It's going to be more of a problem. I don't want to do that. And so acupuncture puts the treatment program in a point of interaction that is possible. Right? And that's why clients come back. Because it's safe, it's possible. And I'm not just believing something, you're not putting something on me. We're working with this whole thing. This is very important with trauma survivors. It's very important with refugees. The refugee, what happened? They lost all their love options. Here they don't know what they have. They don't know what's going on. They don't know what's happening tomorrow. You say, oh yeah, you should go and try for that. Well, how come I just lost everything I got yesterday? I don't feel very adventurous today. I don't want to try a lot of stuff. Well, you could try that school. Yeah, I could fail from that school. I don't want to do that. I failed yesterday. I lost my home. I'm going to lose everything else now. I don't want to lose. So you have to have a treatment that helps the person who's in that state of affairs. Because all of us, if we were made refugees and if we had been damaged when we were young, we'd all be in that state of affairs. And it's a question of how can I come out of that? And the only tool I have is me. That can seem the weakest tool, the most useless tool. How dare you say the only thing that can help me is me when I'm already beaten and I'm already ruined and stuff like that? How can you say that? Because I've seen the thing. And frankly, none of our other tools are working. You can see that as well. Acupuncture is a gateway to the spirit and the growing process, the living process within it. And short of me teaching you yoga for 6 months or Tai Chi for 6 months, I can do this in 2 minutes. We're in a better space. Treatment needs to work as fast as cocaine to retain anybody who uses cocaine. That doesn't mean it does everything. It means it opens the door. It means it sets the table. It means it's part of a cooperative thing. And these are very difficult things to do in private office. They are a very useful thing to do in public sector. Now let's see, I have to do something for 45 minutes until we ask these people. I haven't done 45 yet, though, have I? No. And they're already uncrossing their legs and all that. They're supposed to behave. Put your feet on the ground. You're an image. This is an image. Who knows? You know, she's asking why it's important. Something has to be important, right? You need something to make the image. That's part of it. Yes, sir?
When you're speaking, you're pointing to your hands. Are you using hand points also?
Well, I point to my hands because I like my hands, and all those points would probably be very bothersome. I just use the meridian points that also are on the hand. But if you're treating a person who's a trauma survivor and frightened, I wouldn't do any points on the hand. You need to be polite. And the person needs to have a hand to punch you if you're not doing the right thing. You don't take that away from them. Because then they'll want to punch you right away. Same reason you don't use the feet. I have a lot of patients who want to be ready to kick, want to be able to run away. And the ears are quite convenient for that. Now you could use LI4, for instance. I used to use Heku LI4 when I did